Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady, and we have a great show for you today. I guess it's really not a show. I hate the sound of a show. We have a great episode for you today. I love the episodes that are informative, which they all are, but where I have the honor of having a guest. And the guests that are my favorite are my patients who agree, who are willing to come on and sort of share their experience and as a result, give everyone who's listening some information. So our episode today is about the distinctions between C-sections and abdominoplasties or tummy tucks. And by that I mean is there's a great deal of parallel, yet there's a great deal of difference. And this subject was brought to my attention by Shirley, my patient, who I'm going to introduce in a second, which was really fascinating to me. And it was the first time anyone had described it to me. And therefore, I thought it was a critical episode to have, which is for many women, their precursor to getting an abdominoplasty is a C-section. So naturally, your point of reference is a C-section. So naturally, you assume whatever the hell the C-section was like, this tummy tuck's gotta be worse because it's bigger and more involved. And from what Shirley and I discussed, it couldn't be farther from the truth. And it turns out, and has been now, confirmed by my patients and many, many reviews, is that to their surprise, the abdominoplasty tummy tuck is actually less painful, difficult, challenging than a C-section. So that's really the topic today. So if you had one and you are afraid or you're concerned, you definitely want to pay attention. So with no further ado, Shirley, welcome to the show.
Hi, Dr. Raban. Thanks for having me.
I was telling you before we got on, I don't like having guests on that look better than me. You're beautiful glasses. You have nice lighting. I had to up my game. I went and changed into a pink shirt because of you. Okay, Shirley. So let's give a quick introduction in terms of how you and I met.
Sure.
You are a mom, yes?
Yes, I have 3 beautiful boys.
Mazel tov.
And thank you. And I full-time pharmacist. I work every day and balancing the mom life and the guilt and the everything. I thought maybe I'd take a moment and take care of my body. And I try to learn more about what happened after my C-sections and my pregnancies and the weight gains I had. And I discovered I had diastasis recti, and I delve further, and you get told, oh, physical therapy could fix it. You just have to work at it and bring all the muscles back. And it turns out my OB, he blatantly said, no, the only way to fix it is surgery. And that's the last thing you want to hear after you had a C-section. You don't want to go under the knife again if you don't have to. So I think every mom will come to the conclusion once they've realized and they've exhausted all other options that, I think really something that is out of my hands. And no matter how much weight I lose, this core doesn't exist. The muscles that, you need.
Okay, excellent. So let me do a little basic, because people don't know the specifics. So first question, how old are you?
I'm 38.
38. How tall are you?
5'6".
How much do you roughly weigh?
I currently weigh 157.
So perfect. You're mother of 3, 5'6", 150. In your 150s, you are in great shape. You work out, you exercise, you do all the things you need to do. You had 3 C-sections, correct?
3. Yes.
3. So if anyone knows C-sections, it's going to be you. So you had 3 C-sections, all none of them were emergency or crash C-sections, correct?
The first one was emergency, yes.
Okay, so you even have the distinction between elective, so-called elective, and emergency C-section as a point of reference. Right. And I think we're going to dive right in, because what you brought to my attention, and I said, okay, well, we'd love to have you on the show because you, A, are a mom, B, you went through the entire abdominoplasty experience. And then I asked you specifically, what topic do you think is interesting? And you said to me, I think that people are misled into thinking, oh, I've had a or multiple C-sections, and therefore I know what a tummy tuck's going to be like. Right. So if it was, I don't know, a 7 or an 8 out of 10 in regards to pain, discomfort, recovery, whatever, then I mean, this monstrosity of a scar must be an 11 or 12. And you, along with, I want to say 90% of the patients we operate on, were like, no,
Yes.
that was not the case.
Yes.
So let's go into why that is. I mean, to the layperson or to a man or to an individual who's never had a C-section, a woman who's given natural birth,
Yes.
this doesn't really make sense. We have a small scar and then we have this large scar and you're sewing up a bunch of muscles. But let's first define what each of them are, and then you and I will dive in. A C-section is a surgery in which you cut through the skin, you cut through the subcutaneous fat, you get to the abdominal wall. Every abdominal wall has a muscle on the left and right side called the rectus muscles. And on that muscle is skin of the muscle called fascia. This is sort of the wrapping of the muscle. And when you have a C-section, your OB will make a horizontal cut at the base of your pubis, go down, hit the muscles, then turn vertical, go up and down between your muscles, and pay attention, separate your muscles.
Yeah.
Go into your abdomen, find your uterus, open your uterus, and deliver a healthy baby. At which time they need to close your uterus, so-called sew your muscles back together, which I've been in over 100 C-sections, barely gets done. Close that skin fascia, which turns out to be a really important part of your structure, then the fat, then the skin. In comparison, a tummy tuck, forget about the length of the scar for a moment. That's irrelevant. Skin has almost no pain. You cut through the skin, same. Cut through the subcutaneous fat, same. Get to the muscle layer, and then you sew the muscle layer together using that fascia skin, because that's the strong part, and bring it together. Notice how I didn't say go through it, cut it, separate it, pull it apart, bring a bowling ball through it. So right there is a critical element why, for most people, the C-section is much more painful than an abdominoplasty. So now that we define them and you've had both, why don't you tell me some of those distinctions that you experienced in between the two of them?
Absolutely. Like you described, I mean, a C-section is deep. They're going in you to remove your baby. And I remember even 3 years after my last C-section, anytime I touched my abdominal area, it was painful. I would, get my annual physical, and the doctor, they push on your abdomen, and I would ask him, like, why is this hurt? He's like, oh, well, your body is still recovering from a C-section. So the pain stays. It's deep. With my tummy tuck, honestly, like, it's not, and yes, both you experience numbness. So that wasn't new to me. The numbness, your nerves are, regenerating, figuring things out. But as far as like when I press down on my abdomen now, I don't feel pain. Even on my
first of all, how far out are you?
Let's see, almost, I think 8 weeks.
So I want everyone to listen. Only 8 weeks. That's 2 months. That's nothing. That's diddly. Jesus Christ, people say you need to wait at least 12 to 18 months. So you're only 2 months out. And you're telling me 3 years after your C-section, when your physician would push on your belly, you'd feel a discomfort or tenderness. Forget about numbness. And now 2 months out, that discomfort no longer exists.
No, I don't. Like, I can easily press down on my abdomen as I'm doing now. And that pain's not there. That deep soreness or tenderness does not exist anymore. And it's great because, before you just don't feel like your body was put together correctly, like you described. It's the main goal of a C-section is to, of course, the moms keep them alive, but also get the baby out and make sure the baby's alive and well. So the goal is not to make sure you're put back together the way you arrived. It's, sew her up, get her out of the OR. Let's move on to the next C-section.
So you hit on it. So number one issue is pain, right? So of all the things that prevent women from doing an abdominoplasty, money, time, kids, number one is fear of pain.
Absolutely.
The word on the street is tummy tucks are unbearable. Prepare yourself. It's going to hurt like a mother effer.
Yes.
And people are often shocked, especially if they've had a C-section, as to the significant
Yes.
distinction
Yeah.
of like, whoa. My C-section was like an 8. My tummy tuck was like a 5. And so the reason for that, would you agree? Would you agree that that was a fair analysis of pain level?
Yes. And when I asked you about it during my pre-op, I was like, yeah, but he doesn't know, because you said it's less painful, and I'm like, but how does he really know? And I was like, you know what? Give him the benefit of the doubt and go with that mindset. Be positive about it. Have the tummy tuck, and then really figure it out then, because the fear of pain is true. And I can't tell you, maybe it's your skill level, because I've talked to some other patients who've had tummy tucks, and maybe they the way you sew up your patients, you do it all by yourself. You do all the.
You're absolutely right. I don't know exactly. I'm not to suggest all tummy tucks are less painful than C-sections. That isn't the purpose of this discussion. Right. I'm referring to our experience and our practice and what has been repeated by hundreds. We don't have you as a one-off, like, oh, we just grabbed Shirley because Shirley has this great story. Let's just use that to tell a story. If you go read review after review after review, they're all going to say the same thing, because I have begged patients who are going to write things to address pain, because I know that's a massive obstacle for women. So I always tell people, prepare yourself. It is likely to be less painful. I'd say that 90% of patients agree. 10% said, nah, that wasn't so. It was painful, similar. And so they're almost always surprised. Now, from a physiologic standpoint, that should make sense.
Right.
What is the painful part of the surgery? Cutting the skin? Not at all.
No.
Going through fat? Absolutely no pain. It is muscle. Same as a breast reduction, no pain. Breast augmentation, very painful. It's always muscle that's painful, because the abdominal wall, the muscles, that skin, which is fascia, has all the nervous endings on it. And so anything you do with muscle is painful. So what do you think is more painful? Cutting through the muscle, separating it, you should see pulling a bowling ball through between your muscles, which are separated before babies by about maybe 10 millimeters, a centimeter at most, pulling a bowling ball between it, or sewing muscles together, never going inside, never getting in, nothing, just pulling them together. So it shouldn't like shock you that a C-section is more painful. And as a result, when people go through it and it's done correctly, I do agree that there are lots of patients who are like, no, my friends, bullshit. My friends have had tummy tucks. They all tell me it was unbearable. They've been hunched over for 9 months. I don't know what that specific is. We're going to speak about our technique today. It should be less painful. So that's one thing. What else did you notice to be a significant distinction between C-section and tummy tuck?
Just the differences in focus post-op. When you're recovering from a C-section, your recovery is secondary to keeping a baby alive. You're there to nurse this baby. You've been cooking him in your belly for 9 months, and here he is now, and this is the time to be selfless, right? You're learning how to swaddle them, how to your lack of sleep, you're feeding them throughout the night, your nipples are sore, you don't get a chance to rest. At least, even if you are fortunate to have all the help in the world, the mom guilt comes in, and you're like, I need to be the one. I need to do skin to skin. I need to increase my milk supply. So I need to get up and get out of bed. Now, on the flip side, you have your tummy tuck, and this tummy tuck was a scheduled surgery, unlike, an emergency C-section, which usually emergency C-sections mean you try to labor for 20 plus hours, and then they realize that this is going nowhere and surgery is necessary. There's a lot of trauma with that. I think not enough people discuss the trauma, because you have this beautiful birth plan you've discussed with your OB, and that all goes out the window. And then you're processing all of this during your recovery, and where, C-section, this is the time for you to heal.
You mean tummy tuck?
Sorry, tummy tuck. This is the time for you to heal. You come in, you've done all the research you can, you've invested all this time and money into this moment in your life where you are healing. So you take all the instructions you've been given. 2 weeks, you are in bed and you are healing. You're letting your muscles get to all the sewing that has been done. You're going to keep it there. You're not going to get up and start cleaning the house and picking up your kids and doing things where you would do that after a C-section, because you're not instructed to wear your binder the way you're supposed to, wear it religiously and do all the things you're supposed to do. With the tummy tuck, you're there to recover. You set in line, you get your babysitters for your kids, you get your caregiver, your husband, whoever your loved one is, to help you get those 2 weeks of rest. And then the 4 additional weeks after, you're a little more mobile, you're a little more able to do more independent living. But as far as not having to take care of a newborn, not nursing in the middle of the night, getting rest, sleeping, taking your antibiotics on time and things like that, that's not a reality after a C-section.
Yeah. So those are 2 great points, and I'm going to reiterate them. One is that you can be selfish when it comes to an abdominoplasty, when it comes to recovery. And one is versus being selfless when you have given birth to a child. And the other is the psychological mindset that goes along with the physical mindset. So absolutely, if I do this incredible surgery and you do a shitty recovery, you're going to have a shitty outcome. There is no magic to it. Imagine I do your abdominoplasty and you go to Magic Mountain or Disneyland the next day. So it's going to fall apart.
Right.
So naturally, you give birth to a child. And as you had mentioned, you have this sudden, immediate list of duties that you must do. So while you are trying to so-called recover, you can't physically. Mm-hmm. In addition, you have this mental element, sort of this psychological trauma, as you refer to, which is, oh my God, I may have had a episiotomy, I may still have a hematoma, etc. Conversely, a tummy tuck is this beautifully organized, everything's about you, everyone is in line for you. Even your kids are like on board because they know one way or another that mommy's going to have this procedure. So,
right.
I think that's a significant part, perhaps even plays a contribution in the pain, because can you imagine if you had 2 people who have the exact same surgery, one is up and about and one is resting, who's going to have more pain? Mm-hmm. So I think that thing, both psychologically and physically, the selfishness versus selflessness is very, very important. You touched on another thing briefly, which is mobility. After a C-section or after a tummy tuck, even though I didn't let you be mobile, which did you feel more nimble and mobile with?
I guess with the C-section, you have the pain, but you do get up and do things, which does induce more pain. With the tummy tuck, I just felt I didn't want to engage my core. I didn't want to undo.
Yeah, but that has to do with your fear of ruining what I did, and also the explicit instructions. But what I'm saying is, from a physical standpoint, feeling inside, okay, moving around, etc. To me, it would seem as though the C-section, because of the fact that they severed through those muscles, etc., would be actually more immobilizing than the tummy tuck, although you are significantly less mobile with the tummy tuck because we ask you to be.
Right.
But would you say that the mobility or your body's flow was the same, less, or more with the tummy tuck versus C-section?
I think the first week I definitely felt like I wasn't able to do anything with my core. The first week after the tummy tuck, the binder helps a lot. I remember with the C-section, when I removed the binder, I literally felt like my insides were spilling out. So the binder is important in both, but I didn't feel that way after a tummy tuck. I took off the tummy tuck for a shower, 10 days post-op, and I still felt like I was held in. So absolutely, with the amount of cutting that goes with a C-section, definitely do feel that pain and the less mobility. You just push through.
Yeah, I mean, listen, at the end of the day, again, it's not like anyone gives a shit if it looks good or not good. You're closed. Let's take care of the baby. You mentioned, I'll just touch on this before we go into a break, this binder. So the aftercare is super important, right?
Yes.
So you get, I do a tremendous number of C-sections with celebrities and things like that. I work with some really spectacular OBs, and, celebrities have the luxury of having maybe me come in to close, et cetera, or celebrities not, people that can or want to. So I've been in like 200 C-sections, way more than I would have through my medical school training. And the binders that you guys get from the hospitals for C-sections are not only not helpful, they are damaging because they are super narrow. They're like what we call is 1 or 2 panel, and they actually create much more swelling in the pubic area because they're like a rubber band around your belly. The binders that I use are clad iron, 4 panel, huge, and they're designed that way to facilitate, like you broke your arm, you put it in a goddamn cast. Mm-hmm. You don't go wiggling it around. You put it in a cast and give it a chance to heal. We broke your pelvis. You're walking around. Worse, you have a band around it. So the binder and the quality of the binder and the instructions will for sure make or break some of the experience that one has in distinction, and often color it the wrong way. So listen, we're going to take a quick break, and then we're going to come back. And I think one of the biggest distinctions, or ought to be distinctions, is in the area of scars and healing. So many people have horrible C-sections, scars. They're thick, they're raised, they're retracted, there's skin hanging over. And so naturally, again, whatever a C-section is, multiplied by 3, because a tummy tuck is a C-section on steroids. So that couldn't be further from the truth. And I have had many women say, God, I'd love to get a tummy tuck, but my C-section healed so poorly. I can't imagine having that whole the tummy tuck scar look like my C-section. And that's an error, wrong, no. And I'll come back after the break and we'll explain why that is completely different and give you the secrets of a beautiful scar. All right, so you're going to want to tune into the second half of Plastic Surgery Uncensored. We'll be right back. Welcome back to the second half of Plastic Surgery Uncensored. Myself and my lovely patient Shirley are taking a deep dive into C-sections and tummy tucks, similarities, distinctions, and I think it's so far been significantly more distinctions than similarities. So I don't remember, Shirley, how was your C-section healed? And I know you've had 3, 1 emergency, and then the compounded effects. Would you tell me a little bit, describe your C-section before we had our surgery, or one of the many that you had?
Okay. So C-sections, I think the most traumatic one was the first one, of course. And my mom actually had 5 C-sections. So this was in Iran. So they have different rules there. I know in America we do 3, and you're highly encouraged not to do anymore. And there's reasons for that. And so after having my C-section, the first one, you just don't feel like your insides are in your control anymore. It's your core has been, and I had a big baby. He was over 9 pounds. So, your body's been carrying this weight, and then for it to, the scar.
So what does your scar look like? Because specifically the scar is something that people look down, they're like, this looks terrible. I don't heal well. OBs will often tell patients, I'm so sorry, but this is just the way you healed. And then you assume, naturally, that if I had a tummy tuck, it would heal this way.
Right.
So how did your C-sections heal?
The C-sections, they used a glue, and then after 2 weeks, they removed it, and it was, it faded over time. But initially, of course, there's like a darker shade to it, lumpy, and I guess, you're supposed to massage the scar, and I definitely felt tenderness and soreness. and then the complete difference with the tummy tuck. Tummy tuck, the other day I was doing my Aquaphor and tape, and my oldest son walked by and he's like, "Mom, why did you take a pen and draw on your body?" I said, "That's not a pen. That's actually my scar. It's that thin. It's like
Kids don't lie. You gotta love them.
it's so thin." And I was showing a girlfriend my photos, and she's like, "It looks like it's those if you had those muscles that
Yeah.
like
The obliques.
Aquaman,
Yeah,
the
yeah,
Aquaman,
yeah.
yeah." So it's not bulging. It's not doesn't it's smooth, the
Right.
top
So your
portion.
transition from your abdomen to your pubis is one and the same.
Exactly. And I still have stretch marks on my side, and still it most of the stretch marks on my abdomen have been removed, but the ones on my hips, that skin is so thin, and I don't know how you were able to and it's a nice smooth all around. And I have girlfriends who had C-sections, and they're flat bellies, and they're like, "Now I have a bulge because of
Right.
the way I was sewn back together."
Right. So let's go over this together so we can elaborate. So what are the things that go wrong with C-sections and why? And then what are the things that your plastic surgeon should do differently and it should be better? Now, again, as I always say, there are many horrible tummy tuck scars that make C-section scars look like incredible. And there are many C-section scars that heal beautifully. What I'm referring to are the instances in which the C-section doesn't heal well, and in the instances that you seek a really good surgeon and who does an amazing plastic surgery closure. So what can go wrong? First of all, know that C-section skin should heal and can heal very well because it's very forgiving. So there are many people who get glued and stapled and licked together, and they use stamps to put you together, and it actually heals fine. And that's not because the surgeon did a great job. That's because that area is forgiving. So when you heal shitty, God, they must have done a really crappy job. So where do they do crappy jobs? Number one, when they sew you back together, they don't sew all the layers back together. So what are the layers? They sew the muscle of the uterus, no problem. They all do that. Obviously, there's a hole in there. They sew the muscles together somehow. When they close the skin of the muscle, the fascia, many times they do a shitty job, grab too many layers at once. So I have been in hundreds of C-sections where the OB will grab a very large needle and grab 2 or 3 layers, skin, subcutaneous fat, the whole shebang, one shot. So you're bunching together tissues that should be individually closed into one matted scar. So that creates this ridging effect or this firmness because you're closing the skin of the muscle with the fat above it together. When I close it, I separate each layer into its individual layer, like a 7-layer cake or a 7-layer dip. Each layer is got its own independent closure. So for a sense of efficiency, they'll close many layers together. Many times they forget the fat layer. When you don't close the fat layer, you close the muscle layer and you close the skin layer. Then the skin edges over the course of 6 months to a year start to dunk and dip and retract. And then they adhere to the muscle. So you get this little dent where your scar is. It's retracted. Now, number one, it's uncomfortable because it tethers. When you move, you're playing tennis, you bend down to pick up your kid. Your skin should not be adherent to your muscle, but there's nothing in between it because the fat that was there, even if you're skinny, has retracted. 2, it creates a little speed bump, but in reverse. So always as patients will complain of a little bulge above their C-section. There is no bulge above your C-section. That's the dent in front of the bulge that makes the bulge look large. And then what happens is you get this discontinuity between your abdomen, the scar, and your pubis. And it's this roly-poly thing. And so you might be in great shape. You wear bikinis, you wear an hervé léger dress, you wear something fitted, you will see the lumpiness, and it makes people crazy. So that can occur in a tummy tuck, but usually your surgeon should know better and should be closing layer after layer after layer. The scars often heal shitty because there's a specific element. When you give birth, there's a boatload of fluid coming out of the abdomen, coming out of the uterus. There's meconium, blood. And if that stuff isn't well addressed, cleaned up, everything isn't sutured, you develop fluid inside the incision. And there are hundreds of patients who come to me where the wound separated. And I had a hematoma or a seroma, or they had to open it and pack the wound, because while we closed the layers of this dip, the fluid got in between a layer and it created a disruption and it didn't close. And those wounds didn't heal well. You don't have that kind of fluid after a tummy tuck. It's clean. You don't have blood and meconium and all kinds of crap. And so the infection rate should be and is significantly less, which then leads to a cleaner scar that doesn't look like that. So retraction, thickening, separation, infection, these things are not all that uncommon in a standard C-section. They should be very uncommon in a well-executed tummy tuck. And as a result, if you have a horrible C-section, it is not indicative of you and how you will heal. I have closed, I want to say 1,000 horrifically healed C-sections that converted to tummy tucks, and they're pristine and can never be seen. So what happened to your keloider? You don't heal well. That's all nonsense. It's garbage. 1 out of 1,000 shitty scars is because you make some weird nonsensical scar. So, okay. The other thing that you mentioned is that in a tummy tuck, you not only have your core, but your core has been tightened. Many patients complain that they feel like their guts are hanging out after a C-section, right?
Absolutely.
Like if you cough, all of a sudden, like your uterus would be on the floor?
I mean, it's even standing up with gravity, you feel a load that you
Pressure.
can't hold it in. It's not, you have no control over it. It's just bloop.
So you don't have that element in a tummy tuck. You actually have the opposite. So in addition to the wound being closed well and blah, 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 your core better have been tightened and repaired as if you're wearing it like a corset inside.
Yeah, exactly. All the Spanx I would wear is now within my body,
right,
in a sense. And there was minimal pain. If I had to describe what I went through after the tummy tuck, it was tightness and discomfort. But that's completely different than pain, unbearable, throbbing, the pain you experience after a C-section. I remember like after my C-section, the nurse would come in and push on your uterus to get the rest of the blood out. And that was the worst pain I've experienced, because not only is this a tender, and she just wanted to make sure the uterus was going to contract properly, but I remember like I had to push her hand away because it was just unbearable. And after the tummy tuck, I didn't have any of that pain. I mean, I didn't have anyone pushing down on me, but at the same time, I just felt tightness. If you can understand.
Yeah, of course I do, because that's what we did. We tightened you, and you shouldn't have discomfort. You shouldn't have, pain, but you should have discomfort. Yeah. And yes, you said it actually interesting. There's so many of these, so many things that are indicative. So like you said, a standard C-section, you're in the hospital 2 to 4 days.
Yeah.
Right?
You can't.
A standard tummy tuck, you're home by afternoon. It's outpatient.
Outpatient.
So there are obviously a lot of reasons why that is. But from a surgical standpoint, we do a number on you during a tummy tuck. And so you would think that would need you to stay in the hospital, and it couldn't be farthest from the truth. So when I tell patients, so this is why I thought this was such a great episode is now I'm actually going to refer to this episode because in every pre-op, I always tell patients, trying to be as transparent as possible. I never want to trick a patient. I say pain should be less than your C-section to those patients who have C-sections for reference, or less than a C-section, so they know if women are having C-sections all day long, then this is tolerable. And I swear to God, every single woman looks at me like, you're full of shit.
I was one of them.
No, for sure.
And I can say that you're absolutely right. You're absolutely right. And even if you speak to those women who are like, no, my C-section was much easier, it has to come down to the skill level of the surgeon. I think there are amazing OBs out there, and there are also amazing plastic surgeons. And if you're fortunate enough to have the amazing plastic surgeon, you'll get that recovery that you deserve after your tummy tuck, because C-sections, again, you're the mom's, you're not the primary concern at that moment, right? You're just trying to get the baby out, and then they're sewing you up. So things are not gonna be as complicated after a tummy tuck, in a sense that you're able to take the time and heal properly, and you're not getting up in the middle of the night. The only time you get up is to go to the bathroom for 2 weeks. Like, that's incredible.
And there's someone helping you, for God's sakes.
Yes.
I mean, when you're a mom, you just get up, you go to the bathroom, your husband's like dead asleep. He doesn't give a shit. He's passed out. I think, listen, at the end of the day, the purpose of what we hope to accomplish was to highlight the similarities, which of course there are some, but significant differences between the two. And since a C-section is a very common reference point for women contemplating a tummy tuck, it's a very good anchor point from which for you to make judgments. And I think, for those of you listening, if you think Shirley's experience is a one-off, I would encourage you to read the hundreds, and I mean hundreds, of testimonials from my patients regarding their experience as it applies to pain specifically. And I think you will see 90%, not all, but 90% will reiterate, similarly to Shirley, it was a lot better than I had anticipated. It was predominantly discomfort and some mild burning, and it lasted at best 3 to 5 days. And I think that's fantastic for the exchange, right?
Absolutely.
Yeah. Well, listen, I really appreciate it. I thought this was a super interesting perspective on a topic we've discussed on many occasions. And as always, I'm so grateful when patients, they care, they're willing, they come on, they participate, because, the experience of this podcast is magnified by 1,000 when there is an individual who can corroborate my findings. You know what I mean? So thank you very much, no less on a Sunday. We're grateful, Shirley. All right. Well, as always, that's yet another episode of Plastic Surgery Uncensored. I'm going to ask you, if you enjoy the show, please go write something nice. We live in a very nasty world. Nobody writes nice things. If you don't like the show, don't write anything. Just don't listen. And share this with friends, share this with people that you think might find it interesting, because ultimately the show is irrelevant if you guys aren't listening. It doesn't serve any purpose. So we're always grateful for the downloads and the subscriptions and the reviews. Well, until next time, I'm your host, Dr. Rady Raban. Shirley, have a lovely weekend. We'll see you next week on Plastic Surgery Uncensored.